On this episode of the Ask Mike Reinold Show, we talk about some of our favorite tips for working with lateral epicondylitis or tennis elbow.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the introduction to performance therapy and training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I am joined by the crew at Champion PT and Performance, our physical therapist, strength coach, Dewesh Podell, along with Lisa Russell, Dave Tilley, Dan Pope, Mike Scaduto, Lenny Macrina here, answering all your awesome questions. Awesome this week, not amazing. Awesome questions. PT, fitness, sports performance, career advice, anything you want to talk about. Head to mikereinold.com, click on that podcast link, and you can ask your own question too. Trust me, if you have a question, tons of other people probably have it too, so don't be shy. Submit away. Leonard.
Yes.
Would you like
Another week has gone by, but the students are
great week, everyone.
Wearing the same clothes. You guys did great. Just another day closer to springtime. On that note, we have four beautiful, beautiful students. We have Eric. Do not call me Jennifer King. Sorry, Eric. From Franklin Pierce University in Arizona. We have Johnny Herrera from Regis University. No, I do not have a cheat note, by the way. I know you guys, where you guys go to school, and I know your names at this point. To Johnny's right is Katie Stone. She is from University of Nevada, Las Vegas. Fun fact, Katie is an athletic trainer as well, so we've tapped into that knowledge. And we have Jonathan Sandberg from Creighton University in beautiful Omaha, Nebraska, the home of Warren Buffett.
So for the PT student decathlon that we love to do,
I picked Katie.
Every student gets to pick a task that's in their wheelhouse. It's not fair. Sometimes we have the gymnast students that have some really unique skill sets. But I think we definitely have to have an ankle tape job as part of the decathlon here. I would love to see Jonathan versus Katie in a head-to-head ankle tape off. That would be amazing. Like the NATA convention, go to the NATA convention, the Kramer booth. It's like they time it. There's a leaderboard, right? Like see how fast you can tape an ankle. It's pretty funny. So anywho, all right. What do we got? Eric, what do we have for a question this week?
All right. We have Paul from Switzerland. Do you have any tips on treating tennis elbow? I often see this type of injury, but it always seems to take longer to get better than other injuries.
Awesome. Great question, Paul. Thank you, Eric. Amazing reading. Good job. We have the best students. They can read so well. This is common, right, guys? Right? I feel like there's a few things that we deal with that people struggle with. So I like what Paul said here. It's like, I see this injury a bunch, but it seems to take longer to get better than others. Right. So tennis elbow seems to be like one of those odd ones. So lateral epicondylitis, right? Seems one of those odd ones that just take a while, right? Maybe it's because of the chronicity of it, right? Maybe it's a little bit more beat up, so it takes a little bit longer. But let's talk about this. So, the question for me is about like, what are our tips, right? Not like, let's go through a huge, extensive protocol. Like, what are our tips? So like, Dave, you want to start? Like what's some of your tips for tennis elbow? Maybe we'll just keep going around the room and just going tip by tip and try to knock this out.
Yeah, I have a couple of these patients now that are kind of struggling. And I think, unfortunately, sometimes they don't really realize how a lot of things contribute to the issue. And sometimes it's kind of like, not in their awareness that a lot of different grip activities probably happen. So the couple that I have now, for example, like started after like doing a pull-up program or trying to get their big set of pull-up or something like that. But also we're deadlifting very heavy. Also, we're doing a lot of like split squats and step-ups holding dumbbells. And they were also playing golf on the weekends. And so he was really like, I don't know where this came from, just one day out of the blue. But you look back at his workload program, and since like quarantine, he was like, yeah, I was doing pull-ups and deadlifting and split squats. And then I was trying to golf when the golf course is open. And I was like, kind of realized how all of those things are very grip intensive. And he was like, oh, I didn't even realize that. So he was still he took like time away from his pull-ups. So he thought that was the only thing that caused it, but he was still golfing. He was still doing other stuff. And he's also like, he got a young kid. So he's like holding her and all that kind of stuff. And I think once he was more aware of that, he was able to kind of modify around it. It's hard though, because these things, you need your arms to do stuff, right? You can't not do something in daily life, but just educating him about like the volume of gripping, I think was really important for him. But also he was really kind of going all on the manual therapy, soft tissue care route for a while. And what we needed to teach him on is like, these things need load. You need, like, the load is too high, but no loading is not going to help you. I think we know from research, you're trying to actually produce some load induced changes. So you actually do have to do some exercises to help that build up. So he was kind of riding the roller coaster of no loading because it hurt, to full loading to try to test the waters, quote unquote. So that would be my advice, is have a really good subjective talk first before you start diving into exercises.
Yeah, so it sounds like what he did, he tried to layer some manual therapy, some feel-good stuff, which could be part of a good treatment progression, but he tried to layer that on top of not really adjusting workloads, right? So it's, to use a dramatic example, right? Like my finger hurts because I keep hitting it with a hammer, right? Well, if I keep hitting it with a hammer, but then I go see Dave to massage it, probably not going to do anything, right? So like theoretically, right? So sometimes you have to make the analogy that obvious for people, right? Or so use whatever vision that works best for you. But I think that's a good example of that. So I think tip number one there is that treating without like really assessing their workload, I think is gonna really lead to some issues. I think a lot of people probably that happens to quite a bit, is we just go right into treatments and not enough of trying to really dig in deep on what happened with their workload, right? In a Dave's example, that was a lot of things he was doing, for example, but it might've just been that one thing that threw him over the edge. Like, so you got to really like kind of figure that out. So nice, good tip. All right, who's up next? Tip number 2, who wants to take it? I'm going to blame this on the delay of Zoom and not anybody being hesitant. I like this. Good. Let's see. I'm going to go Pope. I think I saw Pope raise his hand first. What's tip number 2 for tennis elbow?
Yeah, and obviously there's a lot of them. I'm going to try not to take a bunch of them. But I think the big thing is you want to make sure you have a good diagnosis, right? When people have pain on the side of the elbow, the obvious thing we're thinking about is a tennis elbow, but you might be dealing with some humeral radial joint pathology. You might be dealing with, say, a radial nerve issue. So if you're not getting any progress whatsoever, you might just be kind of barking up have the wrong diagnosis going into it. And at least for me, I didn't know a ton about these pathologies until I took a specific course for it. And now I'm just more keen to thinking about other things if something's not improving,
That makes sense, right? So good tip number 2, right? I mean, if we're even if we're slightly off, if we're treating the wrong thing, then we may be spinning our wheels a little bit, or at least some of the things we do may not be working, right? And we may be missing the boat on something. So I like that's a really good one, is like get good at your differential diagnosis of lateral elbow pain. I like that. Lisa, what do you think?
Well, I mean, kind of piggybacking off what both Dan and Dave said, elbow pain I'm like really in my rowing bubble at this one, but it's actually something I'm really expecting a lot of people are going to have a wicked hard time with this spring, because people have not been in boats and not having that same gripping mechanism. And then especially, to get a little rowing technical, but like especially in a bigger boat where you're feathering the oar or you're like shifting your wrists like in timing with gripping. Typically in the spring, tennis elbow and like forearm tendonitis are huge anyway. And then you go from missing almost an entire year in boats for some programs. Like I think it's actually going to be pretty significant. But a lot of rowers who end up with that problem, it's really more that their technique is faulty. So I tend to, kind of, again, what Dan and Dave were talking about, I kind of tend to look back at like, okay, why is your elbow getting overloaded? Because it shouldn't be, maybe like adding in some more gripping exercises outside of, rowing. But at the same time, it's usually like a break in the elbow that's overloading it more and not putting the load in their back of their shoulders and, different things that'll change that loading rather than just like massaging their forearm, you know.
That's great. So I actually picked up on two good tips right there. So Dave talked about just like layering on and overloading, right? Lisa has a really good example of not building your workload capacity up in time. So not building enough chronic workload base before you just go crazy into your whatever activity it is you're doing. So maybe even putting that together with Dave's example, right? Like again, maybe if he didn't, Dave's patient didn't just jump right into that pull-up program and he's eased in a little bit more, maybe that would have been better. So that's another good one. Maybe it's not just the overall quantity, but maybe it was the ramp up progression for that. I like that. And two is the other one is technique. I think that's a really good one, Lisa. A lot of people they're doing things awkwardly. I know in tennis, most tennis people, I don't know, we're not tennis experts here, but like, I think it's like golf, right? Where like a lot of tennis players don't get lateral epicondylitis, right? It's usually the ones that aren't good at tennis and they're flipping their wrist too much, right? They're using the wrong mechanical force instead of using their body to rotate through the ball, right? Same thing with the medial elbow, right? So I think, that's another solid one. So I think maybe to sum it up for this episode, I'll add one more, maybe the fifth one for this one. And I'd just say, and this might be a little similar to Dan's. I think Dan's was like kind of more around like, let's differential diagnose lateral elbow pain and what's going on with the elbow. I would say I really, really want you to clear the cervical spine. Right. And I actually think that that's a large contributor in the things that I see with lateral epicondylitis is coming from the cervical spine. And sometimes you can be completely asymptomatic from cervical issues too, right? Like you can be completely asymptomatic. But the analogy I tend to use is, let's say we have a 5-lane highway of nerves going down your arm. And for whatever reason, we have a bulge, stenosis or something, who knows, something's going on. And only 4 of those lanes are communicating down there, but you're still living life at 100%. Right? Then you're going to overload that. So this muscle is being overloaded by 20% just by living normal life because it's only getting 80% of your signal. Does that make sense? So that may not actually work physiologically, but it's a good like kind of theory to explain to somebody, right? Like to kind of go off that. But I think conceptually that is one thing that I often think people miss is that sometimes we're having some cervical neurogenic issues that go with this and they're just overloading their grip in their elbow. Okay. So solid tips right there. I like how none of our tips involved what to do for treatment, right? None of them was like, do this exercise or do this. I think we all know mobility. I think we all know strength and eccentrics and stuff like that could be important for lateral epicondylitis. I think we all know that, but we still all seem to struggle with the chronicity and how long these take to come back, right? So maybe there's something deeper we need to do with workloads or differential diagnosis or some of their techniques they're using, or maybe even some of the cervical spine put together. So I think that's a really, really good 5-tip kind of process you can go through to kind of to see if we can get better at lateral epicondylitis. So good. Great question. Thanks so much, Paul. Appreciate it. If you have a question like that, head to MikeReinold.com, click on that podcast link, and you can fill out the form to ask us more questions and keep it going. Like we'll keep doing this as long as you guys keep answering questions, right? Although I didn't clear that with everybody. Is everybody good with that? I didn't ask everybody. Okay, good. Everybody. Oh yeah, we'll keep answering questions as long as you keep asking them. So we're here for you guys. Just let us know. Head to iTunes, head to Spotify, subscribe so you can get updates every time we have a new episode, and we will see you on the next episode. Thanks so much.